Did you know anesthesia plays a crucial role in obstetric cases? Yes, you heard it right. Anesthesia is not just about putting you to sleep. It's a life-saving ally during childbirth, ensuring the safety and comfort of both mother and baby. In this video, we'll delve into 22 intriguing facts about anesthesia in obstetric cases. You'll discover just how vital it is and how it has revolutionized maternal health care. So, sit back and prepare to have your mind blown by these fascinating facts about anesthesia. Fact number 1. Anesthesia is not just about putting patients to sleep. It's about making procedures safer and more comfortable. In obstetric cases, anesthesia plays a vital role in easing the birthing process, allowing mothers to welcome their new arrival without experiencing unbearable pain. Moving on to fact number 2, let's delve into some history. The use of anesthesia in obstetric cases dates back to the mid-19th century. The first documented use of ether as an anesthetic during childbirth was in 1847, when Scottish physician James Young Simpson administered it to a woman in labor. This marked a significant turning point in the history of medicine, revolutionizing the way childbirth was perceived and managed. Fact number 3. There are different types of anesthesia used in obstetric cases. The most common are regional anesthesia, such as spinal, epidural, or combined spinal epidural blocks, which numb the lower half of the body while the patient remains conscious. General anesthesia, which induces unconsciousness, is used less frequently, typically in emergency situations or when regional anesthesia is contraindicated. On to fact number 4, the choice of anesthesia depends on several factors, including the health of the mother, the progress of labor, the position of the baby, and even personal preference. Anesthesiologists work in close collaboration with obstetricians to determine the best approach for each individual case. Finally, fact number 5, the role of an anesthesiologist goes beyond administering the anesthetic. They are responsible for monitoring the mother's vital signs throughout the procedure, managing any complications that may arise, and ensuring a smooth recovery post-delivery. Anesthesiologists are an integral part of the obstetric team, providing crucial support to both mother and baby during this important life event. That wraps up our first 5 facts, but there's plenty more to come. Moving on to fact number 6, let's delve into the different types of anesthesia used in obstetric cases. General anesthesia, regional anesthesia, and local anesthesia are all options, each with its own benefits and risks. General anesthesia provides complete loss of consciousness, which is beneficial for emergency situations requiring immediate action. However, it also carries a higher risk of complications, such as aspiration. Fact number 7 highlights the most commonly used method, regional anesthesia. This includes epidural and spinal anesthesia, both of which numb the lower half of the body while allowing the patient to stay awake during the procedure. This method is favored for its lower risk of complications and the ability to allow the mother to be present and alert during the birth of her child. For fact number 8, it's important to know that local anesthesia is generally used for minor procedures, or to numb a small area for the insertion of an epidural or spinal block. It carries the least risk, but also provides the least amount of pain control. Moving on to fact number 9, let's talk about how patients are prepared for anesthesia. An anesthesiologist will evaluate the patient's medical history, conduct a physical exam, and discuss the best options for anesthesia based on the individual's health status and the type of procedure. It's crucial to be honest and thorough during this assessment to ensure the safest and most effective anesthetic plan. Lastly, our 10th fact is about the fasting guidelines before anesthesia. It's generally recommended to refrain from eating or drinking for at least 6 hours before anesthesia to reduce the risk of aspiration. However, these guidelines can vary based on factors such as the type of procedure and individual health status. That's another 5 facts down, but we're just getting started. Let's dive into fact number 11. Did you know that the type of anesthesia used during labor doesn't typically affect the baby? That's right. According to several studies, both epidural and spinal anesthesia have minimal impact on the newborn's APGAR score, a quick test performed on a baby at 1 and 5 minutes after birth to determine their physical condition and any immediate need for extra medical care. Moving on to fact 12, it's fascinating to note that anesthesia isn't only about pain management. In high-risk pregnancies, it can also aid in controlling blood pressure, which is crucial to prevent conditions like preeclampsia, a pregnancy complication characterized by high blood pressure and potential damage to other organ systems. For our 13th fact, let's talk about how anesthesia can assist in managing stress during childbirth. High levels of maternal stress can potentially cause complications. Anesthesia not only helps mitigate pain but also reduces the stress hormone levels, contributing to a smoother delivery process. Now, on to fact 14. Anesthesia in obstetric cases isn't a one-size-fits-all solution. It's tailored to each individual's needs, taking into account factors such as the mother's health, the baby's position, and the progression of labor. Anesthesiologists work closely with obstetricians to determine the best approach for each situation. Finally, for our 15th fact, it's important to debunk a common myth. Getting anesthesia does not mean you're taking the easy way out. Opting for pain relief during childbirth is a personal decision and doesn't make the process any less natural or the mother any less strong. Remember, every birth is unique, and what matters most is the safe arrival of the baby and the health of the mother. With those 5 facts, we're 2/3 of the way through our list. As we approach the end, let's look at fact number 16. Anesthesia for obstetric cases is not a one-size-fits-all solution. Different methods are used based on the patient's health, the baby's position, and the type of delivery. This means that anesthesiologists need to be well-versed in a variety of techniques to ensure the safety and comfort of both mother and baby. Moving on to fact 17, the process of administering anesthesia is meticulously calculated. Anesthesiologists consider factors such as the patient's weight, height, medical history, and even the progression of labor. This precise calculation helps to minimize potential risks and complications. Now on to fact 18. It's a common misconception that you can't eat or drink before receiving anesthesia for a C-section. While it's true for some types of anesthesia, regional anesthesia, commonly used in obstetric cases, often allows for light meals prior to the procedure. However, this is always at the discretion of your healthcare provider. Fact 19 is about the recovery period. After receiving anesthesia, patients are closely monitored until the effects of the drugs have worn off. This is essential to ensure the patient's vital signs remain stable and to address any side effects promptly. Lastly, fact 20. Did you know that the field of obstetric anesthesia is constantly evolving? Anesthesiologists are always researching and developing safer, more effective methods for pain management during childbirth. This commitment to innovation ensures that mothers can have the most comfortable and safest childbirth experience possible. That's 5 more facts for you, with just a couple left to go. And now, for our final 2 facts. Fact 21. The future of obstetric anesthesia is promising, with rapid advancements occurring in the field. The use of artificial intelligence in monitoring and delivering anesthesia is on the horizon. This could potentially enhance patient safety, allowing for more precise delivery of anesthetics and real-time adjustments based on the patient's physiological responses. Moving on to fact 22, here's something you might not have known. The term anesthesia was coined by Oliver Wendell Holmes in the mid-19th century. It comes from the Greek words an, meaning without, and aesthesis, meaning sensation. So, in essence, anesthesia literally means without sensation. Now that we've covered all 22 facts, let's do a quick recap. We've explored the history of obstetric anesthesia, the different types available, and how they are administered. We've also delved into the risks and benefits as well as the role of the anesthesiologist. And we've looked into some lesser-known facts like the role of Queen Victoria in popularizing the use of anesthesia for childbirth and the promising future of AI in this field. And there you have it, 22 fascinating facts about anesthesia for obstetric cases. We hope you've learned something new today.